educational session, you should be able to make an empowered choice in terms of your Medicare plans and needs, okay? So let's get into it. A little bit about me. So I'm a licensed agent, I'm experienced in Medicare, and what I like to do is I like to help people to understand what is the right plan for them and to maximize their benefits. There's a lot of information out there. It can be very confusing. So I like to cut through all the noise for you, what do you do and how does it work? Who I help. So who I help people turning age 65. I help people older than 65 who lost their insurance. I help people who are unhappy with their coverage, who are leaving their employer's insurance and migrating into Medicare, and also on Social Security disability. So here's some of the ABCs of Medicare. Okay, so what is Medicare exactly? Medicare is the U.S. government's largest health insurance program, and it serves about 62 million people. It's run by the federal government. It's for U.S. citizens and legal residents, and it's an individual health insurance. What it's not is, so it's not Medicaid, it's not Social Security, and it's not a family plan. Who can get Medicare? Well, you qualify for Medicare under about 3 conditions. 3 months before you turn 65, or older if you still work. You can be younger than 65 and have a qualifying disability, or you can have a serious chronic disease like end-stage renal disease or ALS like Lou Gehrig's. All of those things make you eligible for Medicare. Also, if you or your spouse may have worked, you can also qualify for Medicare Part A through your spouse, but you must meet the age requirement. So how does Medicare work? I don't know how many of you are on Medicare right now or know someone that's on Medicare right now, but they have a little red and white blue card they have, and it has parts A and parts B. And part A, what part A does, part A is going to cover everything towards your hospital. Anything that's overnight, anything that requires the hospital room or overnight stays or situations where maybe you're in a skilled nursing facility or hospital. That's what part A covers, okay? And then there's part B. So what part B covers the part, your outpatient services. That's your wellness visits, your annual wellness visits. If you have to have an MRI, anything that you go to the doctor and come home the same day, that's what Part B covers. Your office visits, it covers that. Well, what does this cost? Yes, there's cost involved. Some people believe that it's free, but it's not. So let's take a look at what are some of the costs that are associated with Medicare Part A. So if you've worked prior to becoming age 65 and you have enough work credits towards that for about 10 plus years, you will automatically qualify for premium-free original Medicare Part A. Now, in the event that you may not have worked the required number of years, there is a way that you may have to pay a little more premium. And then some people, if they haven't qualified at all, it can be as much as $505 per month. But just for the record, we're going to look at it as you've worked and you've worked your number of years, and so you don't have any premium for Part A. But one of the costs with Part A is that there's always a deductible for Part A. So with Part A, there's a $1,632 deductible per year. That's the part that you have to pay for first before Medicare will pay anything towards those things. In addition to that, there are other costs that are involved with Medicare Part A, which happen days 61 through 90. So if you go to the hospital and you are in the hospital 61 days or more, then you will have copays per day. From days 61 to 90, they go from $408 per day. And then if for some reason you have a catastrophic event and you have to have or be in the hospital greater than 90 days, then the daily rate is $816 per day. Okay, that's for days after day 90. So with Medicare Part B, there is also a cost. With Medicare Part B, there is a $240 deductible per year, okay? And then there is a monthly premium of $174.70. Also, you have a copay that is 20% is going to be your cost sharing. So as you can see, there's a lot of costs that are involved in Medicare. I'm going to go to the next slide. So let's talk about what some of the things that are not covered by original Medicare. So prescription drugs, annual physicals, dental, vision, hearing aids, eyeglasses, long-term cares. And then I know we have some people here who are part-time outside of the US and inside of the US. A lot of things that are not covered are when you're outside of the US. So let's get into nuts and bolts of really, really dig down in to see how Medicare works. If you're with me so far and you understand what I said, let me just see you do a raise a hand, do a hand raise. Okay. Awesome. Okay. All right, so let's move on. All right. So with Medicare, the way it works is that, as you can see in the previous slide, you had lots of areas where things weren't covered, okay? So it creates gaps. And there's two ways that you can go about handling those coverages. One path, or one path we call, is the set and forget path. That's where you get a Medicare supplement plan. And what it is, sometimes it's called a Medigap plan. Those are plans where you can, they cover the gaps. So they cover things like the premiums, some of the deductibles, and some of the out-of-pocket costs. And in addition to that, you also would get a Medicare Part D plan, which would cover your drugs and prescriptions. And that's what they call the set and forget path. The other option you have is you can enroll in something called a Medicare Advantage plan. And it works a little different than original Medicare, and it's because it combines Medicare Part A and Part B, puts them together in a more cost-effective way, and also offers Part D coverage if you choose. And then they offer some, what they call ancillary things, like dental, vision, podiatry visits, and things like that. And they put it into a package, and it's called pay as you go, because you only use your bill when you go in for your office visit. It kind of works like when you had group insurance with your job. So you would go, you would get the card, you would go into the doctor's office, and then they would, you pay a copay, and it would go on from there. So those are the two ways that we handle the gaps in Medicare. Now, I've given a handout here. Raise your hand again for me if you got the handout that I emailed. Okay. Okay. All right. All right. So y'all have this handout. Okay. So what I'm going to do in a little short period of time is I'm really going to get into the nuts and bolts of how it really works. Okay. If you see this handout in the top area there, that part there is kind of represents the little card that you get. As we just went over, we know that Medicare Part A is for anything that happens overnight. And you also know that Medicare Part B are any medical services that happen the same day, okay? So what that looks like is that, come down here, you can clearly see the costs that are associated with just original Medicare Part A. You have that $1,500 or so deductible for first 60 days in the hospital, okay? And then day 61 through day 90, that's when it starts to get interesting. That's when it gets more costly, okay? So you're covered from day 61 through day 90, but at a copay of $389 per day. And then on days 91 through day 159, it gets even more expensive. So per day, your out of pocket is $778. And if for some reason you had a catastrophic illness and you are in the hospital more than 151 days, you pay the whole thing. Medicare does not cover your hospital after 151 days. All of that cost rolls over to you. Okay. With Part B, you see here, you have a annual deductible of $233. And then you have, you'll be paying 20% co-insurance on all your services with Part B, okay? So that's if you go the original Medicare route and you do a supplement, okay? Which is gonna come around, on the average, it costs about $200 a month. And then if you need a drug plan as well, that's gonna be another $50 a month. So you're looking at, if you do a original Medicare, that's Part A, Part B with a Medicare supplement, and a Part D drug coverage, if you combine all that together across 12-month period of time, it's going to run you $3,000 a month. It's kind of set and forget in the sense that whether you get sick or you don't get sick, whether you use it or not, that's going to be your out of cost is going to be $3,000 per year. But if you're relatively healthy, let's say, and what if you don't go to the doctor but 1 or 2 times a year? Well, that's where Medicare Advantage plans come in. What they've done is they've combined Parts A, Part B, and Part D into more affordable plans. And then they've also offer additional benefits. Now, the way these things work is that with your Part C, with your Medicare Advantage plans, they're run by private insurance carriers, similar to, again, to what you may have had with an employer. And the way they're distributed across plans are through PPOs or HMOs. How many of you, if you're familiar with PPOs or HMOs, let me see a show of hands, or just give me a hand raise. Okay, awesome, thank you. Okay. So the way PPOs work, it's through a network. And with the PPO, you can go to any doctor in that network without a referral, okay? But you have to stay within that network, okay? You can go to your doctors, you can go to your pharmacist, you can go to any facilities that are within that network under the PPO, okay? And then the other option is an HMO. Now, HMO works different in that it is a systematic network of doctors and hospitals and facilities that you get services from, but you have to stay within that network to receive those services. They do offer some emergency, outside of the network services, but you're basically bound within those services. Now, with a PPO and an HMO, they are very strong into preventative medicine or preventative wellness programs. So a lot of the wellness visits and things like that, those are covered in the plans, things like vaccines and things like that. But what you want to know is that when you see the Medicare Advantage plans, they're run by private insurance carriers, usually under the auspices of a PPO or an HMO program, and they could be multiple carriers, like your Humana, your Aetna, all of those carriers can have your Medicare Advantage plans. So how do you know which plan is best for you? And the question is, it depends. But the main thing you want to consider is the specific things that are going on with you. Things like, do you have a special needs condition? Your budget, do you have a set of specialists that you see and that you must see? Do you have prescription drugs that you take and you must take? All of these are things that you need to know when selecting a plan. So we're going to go back over to this first right here. Bear with me one moment, I'll be right there. Okay. My deck back here. So you guys following me so far? Give me a show of hands. Have you learned anything that you may not have known before about Medicare? All right. We're going to move right along, okay? So I'm going to go through these slides pretty quickly. So Medicare supplement plans are those plans under original Medicare that are designed to fill the gap of all those things that Medicare doesn't cover, like your Part B premiums, things like that. They're guaranteed renewable, they have nationwide coverage, and they have no provider. It's not a provider network. Ideally, there are 8 plans within it. The most popular of those supplement plans are Plan G. Okay, that's the most popular one today. And I know that I'm talking to my people that are in Panama right now. So I'm just going to draw your attention right here to when you're looking at Medicare supplement options, you want to find something that suits your particular situation and your particular needs. So with all Medicare supplement plans, they all have to cover these basic things. And those basic things are like hospital co-insurance, hospice care insurance, preventative care insurance. But in addition to that, different plans have different benefits. If for some reason you have to go to a nursing home and have skilled nursing care as part of your treatment, you'll notice that some of the plans have it and some of them don't. And then instance where you'll be out of the country, where you have foreign travel emergency, they have coverage. You want to have a plan that takes into consideration that you may not be in the country. Can you use it? So those are the things that work when considering doing a Medicare supplement plan. Now let's do a quick comparison of looking at what about Medicare Part C benefits, so Medicare Advantage. Okay, so if you're in a Medicare program and you need additional things, or you want to do the combined services, you can look at a Medicare Advantage plans. These plans are kind of like a lot of the plans you see advertised on television, where they tell you can get additional services that are not really included in traditional Medicare, things you might need, like routine dental and routine eye exams and hearing aids and wellness programs. A lot of the programs offer benefits like fitness or gym memberships, because they want to keep their members well. Other things that have to go with Medicare Advantage plans is that a lot of times those plans have zero premium or a small premium. You may have to pay out of pocket for the copay and co-insurance when you use the services. And typically there is an annual out-of-pocket cost. But unlike original Medicare, these costs are incurred as you use them. Whereas original Medicare, as we saw in the previous slide, whether you use it or not, it's going to be at least that $3,000 a year. Now, Medicare Part D is prescription drug coverage. You can get prescription drug coverage as a standalone, whether you do a Medicare supplement or whether you choose to do the Medicare Advantage route. But either way, you can still get a prescription drug coverage, okay? And how it works in addition, and that cost will be in addition to your Medicare Part A and Part B, or you can add a Part D as your drug coverage, okay? Or you can do a Medicare Advantage plan, which is one of the plans I described before, which is called Medicare Part C. And you can get that combined with drug coverage. And the way drug coverage works the same way, whether you do Medicare Part A and B original Medicare with a supplement, or whether you do it enrolled in a Medicare Advantage plan. Okay. I'm going to go past this slide. It's just talking about the different income brackets. And then we're going to start talking about the different stages of Part D drug coverage. So the way Part D works is there are 4 stages to the coverage. Okay. And the first stage is called the annual deductible stage. And that is the stage where you'll be paying out of pocket until your deductible is met, okay? And different plans have different deductibles. After your deductible is met, the next stage is called the initial coverage stage. And that stage will cover, or you'll have your cost sharing with your drugs and the plan up to about $5,030, okay? That'll be the total drugs cost. And what I want to back up and say right now is that the way a drug plan works or a Part D plan works, your costs will change throughout the year depending on how fast you use or you reach the end of your initial coverage, okay? So you could start out with paying one fee amount for drugs during your initial coverage phase and end up paying a different amount by the end of the year. And at the end of the year, it all starts over, okay? So as I said before, first you have your annual deductible that has to be met. You're going to be paid out of pocket. Right off the bat, not all plans have an annual deductible, but some do. So if that's the case, you're going to be paying that out of pocket. Next, you're going to have your initial coverage stage. And during that stage, it's going to cover, or you'll be doing cost sharing up to the $5,000. Okay. And I don't know if you can see right here on the screen, what they call the coverage gap, the donut hole. This is where you have to take in some considerations, because depending on how fast you reach your initial coverage limit and you're not up to what they call the catastrophic, if you haven't reached the end of the year, there's that difference between the $5,000 and the $8,000 where your catastrophic coverage begins. That area is called what they call the donut hole. Here's where your costs will change, okay? You will be paying 25% of the cost for your medications on your plan until your plan reaches that 8,000 number. Then once it reaches the 8,000 number, then you're covered by the catastrophic coverage till the end of the year. And then at the end of the year, it starts over again. So let's say, for instance, you're taking an expensive medication that's costing you maybe $300-400 a month. You can see how that's going to impact you over time by the end of the year. And these are the things that you have to take into consideration when choosing a drug coverage plan. Also, with the drug coverage plan, there is the formulary, okay? Different Part D providers have different formularies. They use different pharmacies. So when you're making a choice to select a Part D drug coverage, you want to always make sure with the person you're working with or whomever that your pharmacy of choice is there, okay? Lots of plans have preferred pharmacies in their network, and you'll get lower cost if you use those pharmacies. You want to make sure that the medication that you're taking is in the formulary, or the formulary is a record of the medications that are covered inside of a particular Part D plan. And as you can see here, they have different tiers of medications. Sometimes the first tier of medication, generics are preferred. It's going to be less or zero type of copays associated with that. As you go up in tiers, when you get to the specialty, what we would call specialty brand preferred drugs like that, then the cost sharing is different. But again, it's going to depend on your particular situation and your particular needs. So how do you make a decision? How do you choose? You can see side by side, you have two routes. You can go what we call the set and forget route. That's where you choose Medicare original, what we call original Medicare. And that's where you do a Medicare Part A. And then you get a Part B supplement. And you do Part B, and then you get a Medigap plan and a drug plan. And that way, you will always know pretty much what your cost is going to be. Because those fees are always going to come out to around $3,000 a month in terms of paying for those plans, okay? Now, with the Medicare Advantage option, you get everything original Medicare covers, plus you get you get additional benefits with some of those plans. That's like your eyeglasses, your teeth, your dentist, your gym memberships. Depending on some plans, even have spending cards that help with things like groceries and rent and all types of different advantages. Many of them have zero premium, but they do have a maximum out-of-pocket limit. But those plans also, you may need a referral and you may need to stay in network. Okay. So here's some things to consider when making your decision. Are you willing and able to pay the premiums, co-insurance, and deductible copays? Does the plan have the benefits you're looking for? Is it important to you to, in addition to have those services, to have dental, hearing, and vision? Are you okay if you're choosing an HMO or a PPO with the list of providers and hospitals that are being offered? And lastly, do you feel comfortably using this plan if you have a chronic illness? If you are dealing with some illness or diabetes or something like that, and you need to manage that, are you okay with the plan, the way it works, the providers in the network? Additional things you might want to consider is if you do fall into a category where you have special needs like heart conditions. Do you receive Medicaid from your state? Do you live in a facility or are you going to a facility? All those things you need to consider when making a wise choice about choosing your Medicare plan. A third thing is that, do you need financial assistance with some of the medications that you take? All those things are to be considered. There are plans in place for individuals who need extra help. There's Medicare saving plans, and there's also local assistance programs. Let's talk about enrolling in Medicare, when and how it happens. Well, ideally, you'll enroll in Medicare around 3 months before you turn age 65. There's kind of a 6-month window there. So you're eligible to start your enrollment period 3 months before you turn 65 and 3 months after. Okay? If you don't do that during that time, there are penalties that can apply. For a Medicare supplement, it's 6 months after you're 65 or older and enrolled in Part B. You want to enroll in your Medicare supplement plan. Okay? Once again, you want to enroll in a plan so that you don't incur penalties. Okay? Let's say you're still working at age 65 and your employer has you covered. Well, there's some things you need to know. In some cases, you don't have to apply right then because your employer has you covered, but you have to know if your employer has 20 or more employees, then you can delay it until which time you come off that employer coverage. And you also have to know if they have coverage that has been designated as what is called credible. Okay. Now, if you work for an employer and you're going past 65 and they have fewer than 20 employees, or they're not considered, the coverage is not considered credible, you can end up incurring a penalty because you didn't enroll in Medicare at age 65. Does that make sense? Let me see a show of hands. Raise your hand if you're following me. Awesome, thank you. So we know we don't want to miss that time. Okay. So here's a little bit of what happens if you delay enrolling when you're supposed to. Go past that. If you enroll late, it's a penalty. All right. Let's say that you're already in Medicare, okay? And you want to change your plan. So they have these, like, right now we're in open enrollment, and that's a time of year that you can change your plan. And there's other times that you can change your plan. And then there's also special enrollment periods. So if you don't like the decision that you made, let's say you pick something, you can change it. So the Medicare annual enrollment period right now is happening is from October 15th to December 7th. You can switch a plan, you can join a Medicare Advantage plan, You can switch or drop a prescription drug plan. Okay. So January 1st through March 31st is the Medicare Advantage open enrollment period. It allows you to switch or drop Medicare Advantage plans. So that means not if you're in original Medicare, but if you've chosen a Medicare Advantage plan and it's between January 1st and March 31st, you can change out of that plan and go back to original Medicare, or you can switch to a different plan. Now, there are also certain instances where there are what they call special enrollment periods that you don't incur a penalty. Situations where you lose coverage because your health status changed, if you move to an area that the plan doesn't cover, if you become special needs, if you become eligible to receive certain state finances. They even have a special enrollment period for if you're in an area where there's been a national or emergency declared, and for some reason, due to that national emergency or national disaster, you were not able to apply for coverage, they have special enrollment periods that will allow you to change that. So last but not least, we don't want you to be late enrolling in parts A, part B, and part D, because you can face a penalty. Okay, for part A penalty, if you don't sign up for Medicare when you should, or you're eligible, there's a 10% fee or premium attached to part A. It's the same thing for part B. If you're not qualified for a special enrollment period and you prolong or delay signing up for part B, there's an additional 10%. Okay. And then similarly with part D, if you don't sign up for coverage for the premiums, and you go more than 63 days without what they call creditable coverage, then they charge you 1% on top of the premium when you sign up for it. So at this point, I'd like to ask if there's any questions. Does anybody have any questions? Okay. We'll go past the terminology. And at this part, I just want to thank you all for joining us for this Medicare Information Notes webinar. We invite you to reach out to us directly here at Next Pfizer. There's the number here on the screen, or contact me directly, and we can answer any particular questions that you may have or any other needs. How do we do that? Oh, I got a question. Awesome. How do we do it? Okay, coverage outside of the US. All right, Tony, so here's how it works. So when you are outside of the US, it's going to depend. I showed a slide back. That's one of the things that you're going to look for. When you're making a plan decision, you want to know how that plan is going to work outside the US. Some plans, like some supplemental plans, will have a better choice of how they work outside the US. Sometimes they only work in emergency circumstances. Some plans, things you want to look for is how long you have to be outside the US to come back and visit, or what things like that. That's why I know you guys are expats in Panama. That's why it's important that you understand how that works. But that's how it works in general. But what I'd like to do, or if you'd like to do, we can take it offline and then we can look at your specific situation and be able to help you more with that. But I do know that's a concern. You want that would be a big one for you guys, to know how it's going to work when you're not in the States and whatever restriction that they have. So I hope that answered your question. Are there any other questions? Okay, I got another question. Is this the same question? Okay. Yeah. Enjoy the rest of your day, and we'll be talking again soon.